Okay, so we're sorry to disrupt your day, and you can tell that it takes a team, and you are actually in really good hands with this team here today. And thank you all for coming, and thank you so much for having an interest in healthcare. It takes a special person and a special heart to be in healthcare. My name's Jen Cruikshank. I'm actually the CEO here at the medical center and the clinics. I am a nurse by training, and I've been a nurse for, I hate to admit it, 32 years. And I've been here in the county for a little over 10 years. And so blessed to be a part of a great team, really honored to work with this team and serve this community. We've done some incredible things over the last 10 years, and this organization is just deeply committed to serving the mission and serving our people. So I'm going to hand this off to Leah.
Oh, thank you. I'm Leah Patterson, the Chief of Patient Care Services and Chief Nursing Officer. I've been a nurse for 42 years. I actually started at the age of 14 when I was in high school because I wanted to be a nurse. I wanted to be in healthcare. So I've been in healthcare for 50 years, but I'm actually only 45. So I hope you guys aren't good at math. But I got to tell you, I'm jealous of you all because you're starting on your journey. You're starting on your journey of life and where you're going to go and what you're going to do. And I wish I wasn't this old because I love it. As long as I've been doing it, there's no greater calling than healthcare. And there's so many things you can do. You can do anything. There's no job, if you think about it, that doesn't have some form of healthcare in it, whether it's work comp, whether it's an onboarding nurse, whether it's the insurance company, anything. So it's exciting, and I hope you love it, and I hope you experience everything. And to the point of what the social worker just said, or the case manager, is she's right. Grab every opportunity you can along the way. When I was going through school and nursing, and they'd say, okay, I need you to float to the PACU. I need you to float to the ER. I need you to float. I just relished in that. It was like, give me more, give me more. The more you learn, and now that I'm here in the chief role, you can't know everything. You'll never know everything, and that's why you have all your experts. But if you've dabbled in everything, then when people talk language you don't know real well, you're kind of like, I used to work there. I kind of know what that means. And so it just helps build your platform, and it helps you feel better in what you're doing. So congratulations. Please enjoy the journey. It's hard. It never stops being hard. So just get good at being harder and being good at hard things, and you'll get through it. And you're never alone. You're never alone. You always have people to reach out to keep you through and keep you on this journey. So thank you. I'm going to pass it. Oh, go this way then.
Have you already introduced yourself?
No.
Oh, shit.
I was behind the scenes. No,
No,
don't
no,
even be sorry.
I thought you were in charge.
I thought you, yes.
Dr. Flowers did all the heavy work. Yeah. Good morning. I'm Michelle DeArmond. I'm one of the executive directors here, and I get to work with all of these talented professionals. I'm not a medical professional. I've only been here 3 years. You heard a little bit this morning about the different kinds of, curving journeys that people had to come to where they are today. Mine has been quite curvy. I actually was a journalist and traveled around the country and worked for the Associated Press and did different things for a number of years. And then I worked in politics and government. And eventually, I made my way here to healthcare 3 years ago. So I get to support them in all those other spaces that don't involve touching patients, but I'm helping support with things like this today and getting to just be a part of all the other ways in which we work together as an organization to better our community. So it's a great opportunity. Leah's right. There's really nothing better than this. And like I say, I've done a lot of different things, and this has been probably the most challenging and the most exhilarating. So thanks for being here.
I'll run it down to the end here.
Hi. I am so happy you guys are all here today. I'm Sarah Costa. I'm one of the executive directors, and I am not a nurse by trade. So I started at a very young age. Right after high school, I actually went into banking for 2 years, and my brother actually was a respiratory therapist at a hospital, and I decided, well, I'm going to get my foot in the door. So from banking, I went into cashier. Like Leah said, you never start learning, and you have to take every opportunity. So if you try your very best at everything you do, people notice. People that you don't even think are watching you are watching you. And people would say, hey, by the way, you want to learn this? And I'm like, sure. And then I promote. And hey, you want to try this? Sure, I'll learn it and promote. And before you know it, you learn all the different areas in the hospital. So you go from a cashier to billing to collections. And I was one that didn't do blood, like the brave ones over here. I didn't. I would walk through the ED with blinders, like, no. But there's so much more in healthcare, like Leah said. There's so many opportunities, you know, like the social workers and the case managers, you know, and they're nurses by trade, but they go by the bedside, but they don't have to deal with all the other stuff, right? So have your mind open, learn as much as you can, grow, because healthcare, honestly, it's been my passion. If you would have told me when I started in at the door that I was going to be here for 30-some years, I never would have believed it. But I have enjoyed it. I think it's in my veins. And I have been here at this facility for about a little over 4 years, and I love every minute of it because this team is amazing and the support that you get. So if you guys decide to apply, come here, because it's an amazing place to be, okay? Good luck, and I wish you all the very best. Who's next?
Hi, everybody. Welcome for being here. I see suits out there. You get props. I'm HR, so I look for those things, right? So I'm Colleen Party. I'm the HR business partner that is fortunate enough to support this amazing team right here standing next to me, all of the management and all the employees that are here at the hospital. I've been in HR for 20 plus years, believe it or not. Believe it or not. Yeah. Oh, human resources. So human resources is the one that do all the hiring. We work with staffing, labor relations, all that good stuff. So as Sarah said, when you're ready to get hired, come see me. Bring me your resume. But just again, I've been with HR for 20 plus years. Love it. I've supported all county departments. Every county department has an impact on the community here and the people that we serve, but I'm always drawn to supporting the hospital because I love the staff, the compassion that you see in all of the different positions, classifications that are here supporting the patients, and again, the community as well. So it's great to see you all here, that you obviously have a passion to coming into healthcare, and this hospital is amazing. So if you one day join our team, you're going to be absolutely happy, love it, and feel completely fulfilled. So welcome.
Oh, thanks.
And I got to sneak out.
Hello, everyone. My name's Chelsea. I support our chiefs. I support our administrative office. I've actually been with the county now for 15 years. I started when I was 18 years old in HR. Colleen was my first boss ever. And then I supported the hospital through regulatory surveys on the HR side, so supporting maintaining employee files, compliance housewide. And then about 4 years ago, I moved over to administration to support our chief roles. So I am not nurse, I am not healthcare by trade. I grew up in the healthcare field with my mom being a nurse. But there are a lot of other opportunities out there outside of just nursing. We have a lot of programs where we hire entry level into our float pool, like as patient safety attendants. You don't have to have any experience. You can become a...
Can you define float pool too?
Oh, I'm so sorry.
A couple times. I'm not sure if they
Yeah,
know
so you want to go ahead, Leah?
No, you can do it.
Float pool. So our float pool is made up of employees such as nursing assistants, patient safety attendants, licensed vocational nurses, and registered nurses. That group of people come in every day and they're assigned throughout the hospital where we have shortages, maybe due to people being on vacation, call-offs, anything that might have come up when we need to float nurses between different units. So our float pool does offer a lot of opportunity. Like I was saying, you could come in entry level as a PSA, which is a patient safety attendant. Or a transporter. Yeah, and we send you through basic life support training. You can become a CNA. We partner with a lot of different schools for CNA training. Once you become a CNA or staff member, we have programs such as the 2020 where we support you guys going through nursing school. And like I said, we partner with a lot of different schools. We have a lot of good scholarship opportunities. We have a lot of just different opportunities, even if you don't want to end up in nursing. So I'm very fortunate to work with this wonderful team, and I do very much enjoy my job.
She's just saying that because we're here.
We'll step out and let her. So I'm happy to have this opportunity to wrap this up. So I am Janelle Morris, the Chief Operating Officer here at RUHS. I have been in healthcare for 30 years, but I actually started as a medical assistant. And I will tell you, starting as a medical assistant, actually growing up in this community, going to high school in this community, I don't know that I've ever would have dreamed that I would have been back in this community serving our patients and just our citizens here. So I want to encourage you today, go after your dreams. I too am a registered nurse. However, there's so many different avenues in healthcare that you can take, from being a physician to a nurse, a social worker. We have EVS staff, we have maintenance, we have IT, which is our technology team. We have just a vast amount of team members, and I'm really being deliberate with the word team because we are a team. And we are here as servant leaders. And so follow your dreams, follow your passion. The work we do is hard. You've heard that from a number of individuals today. It's hard work, but it's rewarding work. So hang in there, stay the course, don't give up, and just follow your dreams. This is exciting. Come back and work for us as well.
I'll add, I started at the age of 16, working in the kitchen, not here, but in the hospital. I worked as a clerk, like the cashiers. I did lots of dishes in the hospital. And I was a nursing assistant, became a nurse. But yes, so you can start anywhere. Having the exposure and the experience is really nice to have. It does give you that perspective. And so there's tons of ways in. I don't think I ever thought I'd be the CEO. And it's really these guys that make my job easy. So all right, thank you for your interest, though. I really appreciate it.
As we talked about, the theme of today is you to get tidbits about the opportunities. And as you heard from the first group, who are radiology, lab science, physical therapy, et cetera, and on from all of from a psychologist, from our case management to our social workers, and also the broad spectrum of what you can do and what your future can be. So really want to appreciate these wonderful leaders coming by, welcoming you here. We appreciate you being here today. We've all been excited about it. So we're glad that you got to meet the team who helps lead the hospital. So thank you so much. Thank you. Thank you.